Are the technologies for cancer treatment everywhere, or like if somebody's listening right now and they've turned up the volume because we're talking about them, are they better off to go to Atlanta, or is there something here in Ocala? Well, yeah, maybe Ocala, or maybe Miami, someplace around here?
Yeah, so that's a great question. When new cancer treatments are developed, they're typically tested in clinical trials, and those clinical trials are usually done at these bigger cancer centers like Winship and whatnot. But once these therapies show that they work, they then are able to be used broadly in community settings throughout the United States. So for stage 3 non-small cell lung cancer, I think that a patient in Florida should be getting, chemotherapy and radiation followed by IMFINZI, which is a immunotherapy drug that uses your immune system to attack the cancer.
Okay.
And that's really been a huge breakthrough for stage 3 lung cancer, and we're curing more patients with this approach.
All right, now I want to make sure the listeners know what you said, because there's a word in there that I just learned. It's IMFINZI. What is IMFINZI? And for the audience, it's spelled, because if you're looking at the streaming thing, you got it in front of you. It's IMF as in Frank, INZ as in zebra, IMFINZI. What is that?
Yes, so it is a immunotherapy drug that is given. It's given intravenously, so through your vein, every few weeks. And what it does is it doesn't kill all your normal cells like chemotherapy does. It, in fact, uses your immune system. It causes your immune system to recognize the cancer. Many times what a cancer does is it causes your immune system to not be able to recognize it. And typically, if your immune system sees a cancer, it's going to attack it and cause the cells to go into it and destroy it. And that can go awry when you have a cancer. And IMFINZI is causing your immune system to react to the cancer and bringing that immune surveillance back. And there can be some side effects, and we certainly encourage you to discuss IMFINZI with your healthcare team to see if you're eligible for this drug. And I would encourage any patient with stage 3 lung cancer to be asking your healthcare team about your candidacy for this treatment.
Is it hard to diagnose stage 3 non-small cell lung cancer? Can it be confused with something else?
Yeah, so I think that is a major problem. Many times what we see is that the lung cancer may not be completely staged, such that you could be giving patients a diagnosis of stage 4 lung cancer when in fact it is a stage 3. And that's really important because you want to make sure that you're given a chance for curative therapy. So as a patient, if they tell you have lung cancer, you need to make sure that you're getting that whole body PET scan, and you're getting a brain MRI, and that they're doing biopsies of the lymph nodes that are enlarged on your CT scan, so that you can really be sure of the stage of your cancer. Because if your cancer is assigned an incorrect stage, the treatment is not going to be as effective.
Wow.
And I think that's really one of the major barriers.
I don't know if this, again, I'm trying to ask questions that somebody going through this would want me to ask. So the one I have is about metastasizing. So your website, I went to your website, it's imfinzi.com, right? Or is it .org? Imfinzi.com, I found it, okay. So it shows at the very top of the page, lung cancer and bladder cancer. And the question I have about metastasizing is, if it has metastasized and you do it intravenously, does it also help with the other places in the body where it will be found?
So yes, immunotherapy does help with cancers that have spread. Now, IMFINZI is used right now for stage 3 lung cancer, which is cancer that has not spread. There are certainly other immunotherapy drugs that are used for stage 4 non-small cell lung cancer, but the critical thing, to your point, about asking questions that you want patients to be aware of, as a patient, you want to go into your visit with your doctor and say, what stage is my cancer? What studies have been done to ensure that this stage is accurate? because that is going to be what drives your treatment.
Can a patient
So
have more than one?
My message to patients is just to make sure that you're going in with those questions.
Okay, real quick, I want to apologize for talking over you. There's a delay, and I'm going to use that as my excuse. It was hard to tell sometimes when we're done, just so you know. But I have a question about cancer in general. Can a person have more than one type of cancer? Could somebody have lung cancer and prostate cancer at the same time?
Yes, that is possible, and we see that relatively,
really?
Not infrequently.
Okay.
People having more than one cancer. Mm-hmm.
And what are the survival rates?
Well, again, so the survival of your cancer is really dependent upon the stage of the cancer. With the new approaches that we're using for stage 3 non-small cell lung cancer, with the radiation and chemotherapy followed by the IMFINZI, that has actually shown to reduce the risk of death by about 32% compared to radiation and chemotherapy alone. And so that's really an exciting opportunity for us to cure more patients with stage 3 non-small cell lung cancer. And that's really why we want to get the word out that there should be more hope once you hear that diagnosis of cancer. And really, we want people to be encouraged to seek treatment. I still see some patients saying they don't even want treatment for their lung cancer because they think that it won't do much good. But really, our treatments have changed, and your cancer isn't your grandmother's cancer, and our technologies have gotten so much better, and we're able to offer patients a lot more.
God bless you.
The best thing we can do as a radio show is to give the information to the audience so they can look at this further. Is the website the best idea?
So there's a lot of different ways to gather content for lung cancer. I would encourage people to look at National Cancer Institute, American Cancer Society. For IMFINZI, the immunotherapy in stage 3 non-small cell lung cancer, you can go to imfinzi.com.
And that is, again, is IM, as in Mary, F, as in Frank, INZI, imfinzi.com. Dr. Kristin Higgins, thank you for sharing your knowledge with us and for helping give hope to some people who probably need it. Thank you.
Absolutely. Take care.
You're welcome. We'll be right back.
Hi, Matt Wilkerson here, your Verizon representative with news that will hum your car, make it smart and safe. How? With the new Hum device by Verizon. You can rest assured you're never alone. Flat tire? Lost? Accident? For $10 a month, Hum by Verizon has you covered. And I will come to you in Marion County to install the Hum for free. Time to call me at 352-528-0020. Are you ready to hum along?